Hi, it's Snackable Health with Gibson and Lam. Carolyn, launching a new series.
Absolutely, where we will expose the cracks, give you the facts, and give you those snacks.
All right, we got a snack for you from ACC 2025. What was hot in heart failure? I know the Summit trial, some of the EGFR data. What did you think?
Oh, that was very interesting. So, the Summit trial was really something that rocked our world because it was an incretin-based therapy of the dual agonist, GLP-1 receptor agonist with a GIP agonist, tirzepatide, given to patients with HFpEF and obesity. And for the first time being shown in a primary outcome that included clinical outcomes. So not just phase 2 trial looking at weight loss and so on, but at clinical events and was strongly positive. So everyone's sort of really, really intrigued, wondering what the guidelines will do about it. But in this ACC, what they presented is the GFR spectrum in other words, looking very much closely at that CKM syndrome.
Mhm.
Everyone's heard about it. C for cardiac, K for kidney, M for metabolic syndrome. And so, really showing that patients who have this combined syndrome had a worse outcome, showing that tirzepatide was beneficial regardless of the spectrum of baseline GFR. But what I thought was really, really interesting was showing that there were discrepancies with the measurements of GFR based on whether they were creatinine based or
Mhm.
cystatin based. And I
Ah,
thought that was very revealing because we know that creatinine is related to muscle loss, and that can happen with weight loss and so on, right? But
mhm.
cystatin too has a relationship with adipocytes.
Ah,
So, watching how that plays out is one thing. So look at the paper. But the other realization is we may need better ways of characterizing GFR and may need to take into account the confounding influence of creatinine and fat changes, muscle mass and fat changes in these patients as we look at GFR.
I mean, we have so much to learn in this area, right? I mean, the muscle wasting phenomena, is it really losing muscle mass or is it just losing the fat between the muscle fibers? And is it skeletal mass or heart mass as well? And it's amazing how little we know.
Exactly. And, it's very easy to jump to simple conclusions, but on the other hand, it's very well shown as well that the weight loss causes patients to be more active.
Hmm.
And so if you're more active, you're also less likely to lose the muscle mass. So it's not a simple thing to tease out. And you're right, it's a great area of
I
interest.
feel like we're back at the beginning of the statin story where everyone just said cholesterol, total cholesterol, cholesterol three less than 300 is the goal. I mean, I think we're at the very beginning of a very long journey. Also, some
Huge
interesting
market.
findings related to iron in heart failure. That's had quite a journey, iron therapy. What
Yes.
did we learn at this meeting?
So the FAIR HF2 trial was definitely much anticipated. So it was looking at the impact of intravenous ferric carboxy maltose in patients with HFrEF and iron deficiency, but really trying to look at clinical outcomes. Now, first of all, IV iron is already in our guidelines for reduction in hospitalizations based on FAIR HF1 trial, based on the confirm and affirm trials, and so on. But that real outcome reduction has been missing. And so it was very much anticipated. The primary outcomes were the traditional, there were three co-primary outcomes. Traditional time to first cardiovascular death or heart failure hospitalization, then there was total heart failure hospitalization, and then there was a sub-analysis specifically in patients who had a TSAT of less than 20%, where we're trying to see that the field is moving towards characterizing that patient with that single measurement. Unfortunately, it did not reach its primary endpoint. So that is kind of like a bummer because we were, hoping that this would be the nail in the coffin. That's not a bad that's a bad analogy, but the thing that just sort of elevates this to a higher level recommendation. Having said that, though, there was very robust evidence of improvement in quality of life, not the primary
Right,
outcome, but in quality of
right.
life. And I suppose, looking at the trends in all the events, they were fewer in those that were treated with
Mhm.
IV iron. So I would say results consistent with what we already know. It's always nice to have more evidence in prospective way. Now, why didn't it hit its endpoint? We could go to town, pontificating. There was a little impact of COVID and all of that as well.
Sure.
But at the end of the day, I don't think it's going to take iron away from the guidelines. I'm not sure it's going to really elevate things. And I think more data is needed.
Yeah, well, obviously, we always want to add years to people's lives. That's what we focus on in primary endpoints, but we also want to add life to those years. And it sounds like we may have done a little bit of adding some life to those years. So that's not all bad. Now, we also had the first report of some gene therapy in heart failure. Give us a peek at peak.
Yeah, now that is really cool. So now the gene therapy story in the heart failure context has been all focused on amyloid, right, so far.
Mhm,
But there was a small phase 1 trial result that was reported in hypertrophic cardiomyopathy.
mhm,
This time, a sort of a gene transfer technique, kind of conventional adenovirus gene transfer of the MYBPC3 gene, and that's the myosin gene that we know is involved in quite a few cases of
mhm.
hypertrophic cardiomyopathy.
A
So
lot of
phase
variants,
one,
right? I mean, there's a lot of hokum
yeah,
variants,
yeah,
right?
yeah.
Mhm.
But as a proof of principle of gene therapy for hypertrophic cardiomyopathy, this was really kind of cool. As My Peak One was the name of the trial, and basically showed safety and a suggestion of stabilizing these patients with severe hypertrophic cardiomyopathy. Now, again, phase 1 is not powered to look at efficacy and so on, but tantalizing. And
Mm.
they're looking at some different doses now, and hopefully will go on to later phases of the trial.
That was all a lot of provocative data. We're moving away from heart failure, hopefully to heart success, as you and I've talked about in the past. So stay tuned. Lots of, I'm sure, exciting stuff coming up in the future. Thanks for our first snack with
I
Gibson.
liked it. I hope everyone else did. I'm sure they did.
Great. Thanks, Carolyn. Thanks for joining us. And thanks to all of you for joining us out there in the audience.